So moving down to the hands now. Now then, what are the problems that we encountered with regard to in the area of the hands? Well, numbness is certainly common. Numbness around the hands, particularly that of the thumb, the index, and the middle finger. Many patients complain of numbness, particularly at night or early hours of the morning. Now, then, in severe cases, many patients may complain of numbness all the time.
然后我们现在来看一个会影响我们手部的一些症状，然后这个就是叫做腕管综合症。腕管综合症其实会影响病人的拇指、食指和中指，感觉到疼痛或麻痹。很多病人通常就是在晚间要睡觉的时候，或者是刚刚起床的时候，感觉到疼痛或麻痹。可是比较严重的案例的话，是全天性的话，都会感觉到疼痛或麻痹。
Now, then, what's the cause of this problem, otherwise known as carpal tunnel syndrome? Well, this the reason is because the nerve known as the median nerve passes through a very tight tunnel and innervates these three fingers. Now then, as we get older, sometimes the actual tunnel in itself, known as the transverse carpal ligament, or the carpal tunnel, becomes very narrow and tight, and this results in compression to this particular nerve, resulting in irritation to the nerve.
所以是什么原因造成腕管综合症呢？其实就是因为我们的正中神经被压迫到，因为它要经过我们手腕的一个韧带，然后很多时候当我们年纪比较大的时候，那个管道会比较狭窄，所以当它比较狭窄的时候，就会压迫到我们的正中神经，导致它感觉到疼痛或麻痹。
Now then, another common problem is otherwise known as ulnar nerve syndrome. Now then, this condition differs from that of the carpal tunnel syndrome in that the numbness is likely to be affecting the little finger and the ring finger.
所以我们现在来看另外一个也会影响到我们手指疼痛或麻痹的一个症状，叫做磁神经综合症。然后磁神经综合症其实会影响到我们的无名指和我们的小指，感觉到疼痛或麻痹。
Now then, in this condition, the nerve being affected is the known as the ulnar nerve, and this nerve is found at the back of the elbow, and it's more on the inner aspects of the elbow, and that this particular nerve passes through a tunnel known as the cubital tunnel, and that it is here where the nerve is being compressed, resulting in irritation and inflammation.
然后这磁神经综合症其实跟我们的腕管综合症有点不一样，因为这磁神经是其实通过我们在我们的手镯的一个管道，然后当它被压迫的时候，才会感觉到疼痛或麻痹。
Now then, another common problem is pain around the thumb area. This condition has a rather long name. It's called Decovenes stenosing tenosynovitis, and it's in this condition, patients complains of pain at the back of the thumb, usually in the root area, quite close to the root of the thumb, quite close to the wrist, and that a patient will have a very localized tender spot with increasing pain on bending the thumb either backwards or forward.
所以另外一个会影响到我们的手指就是狭甲性腱鞘炎。这狭甲性腱鞘炎会影响到我们的拇指，然后它的原因所在地就是它会在我们的拇指的尾端，就是在我们的手腕的部位，就是连接的那个部位，感觉到非常的疼痛，然后病人就很难就是弯曲他们的拇指，然后就感觉到非常的僵硬。
Another common presentation is the patient presents with lumps around the wrist. Now then, this is also a common problem. It's known as a wrist ganglion, and that the lumps comes in various different sizes, and that they can be either the back of the wrist or the front of the wrist.
然后另外一个非常常见的话，就是在我们的手腕的部位感觉到有一些肿块，然后这些肿块其实是没有就是良性的，然后如果它 是非常小的话，这样其实就不用去处理它。可是如果它长得太大的话，然后也会感觉到痛，然后会影响到我们的手腕的一些动作的话，这样可能就需要一个小手术把它清除掉。
Now, in the case of the fingers, trigger finger is also quite common. What is trigger finger? Well, this particular condition is because of acute inflammation of the tendon sheath that surrounds the tendon. Now then, in these conditions, the patient will have problems in either closing the fingers or opening the hands.
然后另外一个非常常见的一个问题就是扳机手，扳机手就会影响到病人，当他们要合起手，就是不能完全合起来，或者是要把手张开的话，手指就会卡在一个部位。然后这个就是因为我们的腱鞘发炎了，导致那个筋不能顺利的把手指张开或合起来。
Now then, to treat this common problem, usually we will start off with giving an injection if the condition hasn't been around for for long. Now then, if the problem's been there for quite some time, then a small surgical procedure may be required, and this involves in making the tunnel to be larger to allow the tendon to slide more easily.
然后，如果这个只是一个初步的一个问题，就是就是关于这些管道的一些部位的话，这样其实打消炎针其实就是可以大大的帮助到病人。然后，可是如果是比较长久，就是已经有这个问题已经很久的一个的时候，这样可能就是需要做一个非常小的手术，就是直接把那个管道弄开。当它弄开，就不会压迫到那些神经或者是筋，这样其实就会就是完全解除掉这个问题。